Today, we got the opportunity to sit down with one of the greats of functional medicine, Dr. Dan Lukaczer. And this episode is so unique because instead of deep diving into the granular, fine details of medicine, it was really the teacher student moment where he actually was kind of teaching us how to really think in the realm of functional medicine.
And I particularly appreciated that he spoke to the intersection between naturopathic medicine and functional medicine. Ultimately, he's a humble, inspiring, and extremely wise practitioner who offers insight on functional medicine and also adding in how to discern between supplements and labs, which oftentimes can feel like such a challenge in this huge industry that oftentimes feels like the Wild West. So let's glean some wisdom from Dr. Dan Lukaczer and jump into it. Hello and welcome to the Vibrant Wellness Podcast. I'm your host, Dr. Emmy Brown, here with my brilliant co-host, Melissa Gentile. Today we have a special guest, Dr. Dan Lukaczer, a trailblazer in the field of functional medicine with over 3 decades of experience as a licensed naturopathic doctor, in addition to serving as the past director of clinical research at Metagenics Functional Medicine Research Center, and now as the director of medical education at the Institute for Functional Medicine. Dr. Lukaczer has dedicated his life to exploring the root cause of chronic illnesses, addressing many complex conditions, including digestive issues, autoimmune disease, and metabolic dysfunction. With a career rich in clinical and functional medicine experience, Dr. Lukaczer is an expert on the evolution of the functional medicine model, and I bet has a good grasp on its future as well.
Hey, listeners, I want to take a quick moment to share some exciting news with you all. Transform your practice at the Vibrant Longevity Summit with insights from leading minds in medicine. Join us in San Jose, California, and learn from longevity's biggest thought leaders such as Dr. Jeffrey Gladden, Dr. Mark Hyman, Dr. Jess Petras, and many other longevity experts. Take this step towards elevating your approach to healthcare this September 27th and 28th, and register now at www.vibrant-longevity-summit.com.
We can't wait to learn about where functional medicine has been and where it's going through the wise lens of Dr. Lukaczer's many years of experience. Let's welcome Dr. Dan Lukaczer. Dan, thank you so much for being here.
You, and if you could send me that intro, I like it. I think I want to use it myself.
You got it. Noted. I'm glad you like it. Okay, so let's kick this off. Dan, I'm curious, with your background, you're a naturopathic doctor by training. And so what made you want to really expand on the teachings of naturopathic medicine to include functional medicine in your practice?
Well, that does take me back a bit. And so I am, yes, a naturopathic doctor licensed in the state of Washington. And when I first graduated from naturopathic medical school many moons ago, I actually, and I think that the training has improved, but just the overall way that I was looking at health and disease, I didn't have as strong a grasp on that. I didn't have the model that was helping me as much. So I was looking around for that model. And I, at some level, stumbled upon a PhD biochemist that I think many of us know now by the name of Jeffrey Bland. And Jeff was giving a series of lectures on detoxification, in fact. And I was, as many people are, I was kind of entranced with how he put things together in a systems biology, and put things, even in that weekend lecture, put things in a way that I thought really started to allow me to understand how things were fitting together. And that's how I initially got involved with functional medicine. I was in private practice for a number of years, and then eventually actually started to work for Dr. Bland at where he was at HealthCom initially, and then HealthCom merged with Metagenics, and then the Institute for Functional Medicine was part of that merger. And then later, the Institute for Functional Medicine became a 501c3, a nonprofit. So outside of any commercial interest in 2000, and I started working directly for the Institute for Functional Medicine in 2007. So that's a long-winded way of saying, I think what attracted me to functional medicine was it was the operating system that at the time when I first met Jeff, I don't think that operating system was completely operational, but I could see how he was just had a mind that synthesized things in such a way. And he, along with a number of other clinicians and colleagues, started to create that model, which we call the functional medicine matrix model. And I look at that as kind of, many people that are listening may not, know what is the functional medicine matrix model. Well, you can look at it online, but it is really a thinking pad for how you see the clinical picture of a patient. And there's a lot to it, but that's the foundation of how I got interested in functional medicine. And at the time, it was fairly nascent, and now I think it's through Dr. Bland and really a lot of people. I think functional medicine has made its mark in the integrative medicine community.
Absolutely. Yes, to say the least. And you mentioned the functional medicine matrix, Dan. And when I was in naturopathic medical school, we talked about the timeline. That was a very, very kind of simplified introduction for me to functional medicine, starting, at birth. What happened at birth? What kind of traumas from very early childhood? Is that part of the matrix for listeners? I think a lot of us are familiar with the timeline, but what else is
That
included?
that is part of the matrix model. So the matrix model, we sometimes talk about the matrix model and the timeline, and just what you said, Emmy, about a timeline. And I'll kind of step back and say, we didn't make up the timeline. Narrative
Sure.
medicine, we didn't make that up. We learned old things in new ways, I think, and so we brought that to the fore. And so the timeline is, just as you said, a way to catalog essentially the matrix model. And the matrix model is looking at what another very, very well-known, I think, clinician named Leo Gallen came up with, this kind of concept of looking at what is called antecedents, triggers, and mediators of the person's health. And that is put on this matrix model. We look at these antecedents, triggers, and mediators on a timeline. What are the predisposing factors? What are the triggers that may be suggestive or suggest some sort of connection with a particular health issue? And then what are the ongoing mediators? Those are all part of the timeline that are then inserted into this matrix model, which has these antecedents, triggers, and mediators. And then we look at these, what we call foundational personalized lifestyle factors, which we all know about. And then we look at these clinical imbalances, and there are a variety of clinical imbalances that we've named in different ways: assimilation and immune dysfunction, and energy or mitochondrial dysfunction. We kind of go around the horn of looking at those, and that is in essence the matrix model. So you take the timeline and you apply it to that model, and then as a clinician, as the three of us are clinicians, then applying that individual's life to that model, so that then you can come up with ways to proceed. What areas, as we sometimes say, what areas have the most ink? What are the important clinical imbalances that you want to focus on? What are the important? Of course, we want to focus on all of these personalized lifestyle factors: nutrition and connection, and stress and sleep and movement. But there may be some that, for that particular individual, you can see that those are the key areas to focus on. So that's in a nutshell. And as I ramble on, that is the matrix model.
Well, and that's helpful for listeners who aren't familiar. And we know Dr. Gallen. We interviewed him on this very podcast, and
Oh,
he's
wonderful.
yes, he's a wealth of information as well. So, and it helps us apply those naturopathic principles that we learn in a very comprehensive history taking. But it's a little bit easier to understand when you put it in that kind of functional medicine framework. So, thank you for walking us through that.
Yeah, and I would say, I mean, that I think that naturopathic medicine and functional medicine, to me, are two sides of the same coin. We can, and I think that what functional medicine did for me is it again provided that framework on which to put all of these different therapeutic interventions that I was learning in naturopathic medical school.
Sure. Yes, it's very clear. We get so many modalities thrown at us in naturopathic medical school, and where do you know how do we know where to start with these complex histories? And so I think that framework is extremely helpful. Well, and that begs the question. I would love to focus a little bit more on the patient now, Dan. So everyone wants a quick fix. We all want immediate results.
I do.
We all do, of course. So how do you manage patient expectations when we're trying to adhere to these principles of functional medicine, where it is so comprehensive and it takes a lot of compliance and it takes patience? A patient needs to be patient, especially with this
Yeah.
puddle.
Well, I think that's the age-old question because I think it's very easy to practice this term that I'm sure you're familiar with, the practice green medicine, and substituting a botanical for a medication, for a
Right.
pharmaceutical. And
Right.
while that is not always wrong, I think that we really need to look at foundations and look at how do you change physiology as opposed to take over physiology. And so, in answer to your question, is I think part of what I talked about, that matrix model, and part of we're big on mnemonics in functional medicine. So we have this mnemonic called "Go to it," which is you gather, organize, tell, order, initiate, and track a patient's progress, if you will. And in the middle of that, which is tell, is that you want to really help that individual sitting before you understand why things are happening to them, or what is happening and why that is happening. And I think in that process, hopefully you also, just as you said, you're also trying to give them, if you will, an understanding of those kinds of things that will take to not just suppress the symptom. And don't get me wrong, if I break my leg, I'll knock on wood, but there are acute care medicine in the United States, when you can get it, is very, very good. And you want to do some things to suppress that pain. But in the long term, and that's really where I think functional medicine shines, naturopathic medicine shines. In the long term, you want to look at things that, how do you build the system, that individual? How do you build that system to create health as opposed to just trying to manage disease? And I think in talking to a patient in that way, hopefully you can get them to understand that this is not a quick fix, but it should be looking at all of these factors and trying to help them organize those factors into a coherent whole so that um, they can understand how to move forward, and also hopefully help them understand and why they would want to move forward in that way. So hopefully I answered your question in that kind of overview, but I think you have to, what we unfortunately, I think, don't have enough time and don't do enough of sitting first, listening to that individual. We have, 2 ears and one mouth in that proportion, for so that we can do more listening, I think, and listen to that individual, what they're looking for, and how you can help them achieve their health goals.
I love that, Dr. Dan. And I like how you mentioned or put so much emphasis on the education piece with the patient and kind of helping the patient understand where they got to where they are now, and, how long it's actually going to take to move forward. And I do want to ask, when you are taking patients through these initial consultations and sitting down with them for the first time, like, what are some things that you touch on in that initial consult? And, how has your consultations initially changed over time? Because I'm sure there's probably a lot that you've had to adjust over your many years of experience.
That's a great question. How have things changed over time? I would say that my consultations have changed over time as I have, at some level, grown up with some of these concepts of functional medicine. So the timeline, when I got out of school, I wasn't actually using a timeline. So 20 years ago, I started, I would say, consciously using a timeline. I think we all at some level look at a timeline, but now I consciously have in my interview, and I tell the patient what I'm going to do, why I'm asking them all these questions initially. I certainly want to know, well, what brought them in and what are their goals and what are their presenting health issues. But then I will go back to the 39 years of their life, and I will, after I've kind of finished with that initial overview, I will start with of course I have forms, et cetera, but I'll want to start with what are the genetic antecedents that they may have. So looking at their family history, and then I'll go back and I'll actually start on, how was your birth? Did your mother have any health issues during birth? Were you born vaginally or by C-section? And then what was your health as an infant, as a toddler, blah, blah, blah. So going forward. And so that has changed over now the past couple of decades, but I do that. And then what I also do is at the end of that first interview, if you will, I will try to reflect back in that, as I mentioned in that model of retelling that individual story with my commentary involved of, why do I think that all of those antibiotics that you got as a teenager for acne, and then you got as a young woman for UTIs in your 20s, why that may in fact be important for what's going on in your 30s and where you've been diagnosed with rheumatoid arthritis. So, and then what should we do about it? How should we evaluate that? What should we do therapeutically? Where should we start? So that's a significant, I think, change for me over many years in terms of how my interview has changed, I would say.
And in those interviews, are you able to kind of pick out any or spot anything that allows you to predict the success of healing within a patient? Like, is there a certain mindset or anything that you're able to pick up on?
With the individual, with the patient.
Yeah. Yeah, like when the patient comes in, is there anything like, do you have a feeling or is there anything in the initial consult that just kind of helps you predict their outcome?
Well, I think there's two. I would give you two answers, I think, to that question. One is what that individual is like and what they, how they are presenting, and so if sometimes I just saw a 36-year-old male yesterday, and I hadn't seen him in a couple of years actually, and I think I could have predicted that because he was looking for that quick fix. And in fact, when I saw him a couple of years ago and he did a few things, whether those things that I had prescribed for him or just a tincture of time, these fasciculations that he had and his anxiety had, I prescribed a few things for that, but he hadn't, and he got much better. But so now he was coming back 2 years later, or almost 2 years later, because he now had what was going on. He just he had some kind of anxiety and heart palpitations that had been significantly worked up from a conventional standpoint, and he wanted, well, so what did I have to offer? So I could have predicted that he's looking for what's that herb, or what's that botanical, or what's that nutraceutical, which is okay. I can work with him. I'm trying. He came back, so maybe certainly I did something for him initially, and so that's good. You have to get some traction with somebody. So I think I could have predicted, if I was predicting that, yeah, he was not going to do a whole lot of foundational things when I first saw it. So you can predict some people in that way. And then the other part of that, Melissa, that I said there were two things. That the second part is, well, there are certain conditions, quote unquote conditions, that I feel I can get a lot of traction pretty quickly because I've either, I'm on the West Coast, and I live in Tacoma, and there's a freeway, I-5 goes up to Seattle. I pretty much don't need a map to get from Tacoma to Seattle. I know how to get there. I know there's a lot of different ways to get there. So there are some conditions like IBS, or like for me, because I work with a lot of thyroid patients, so autoimmune thyroiditis. So I have a pretty good idea of how to assess those, and I have a lot of good ways in which I think I can see success. So there are conditions like that I feel that I have a pretty good idea of if I have 12 to 16 weeks with that patient, I have a pretty good idea that I can have a lot of success. And then there's other conditions that both of you are probably very familiar with now. We're all familiar with long COVID, for instance, or chronic fatigue. And that is a combination of, well, who is that patient? What directions do they want to go in? And, it's a combination of, well, there's a lot of, as another fairly well-known functional medicine practitioner named Sid Baker has said, it's, functional medicine is, where I think he's probably said just medicine is sort of like tailoring, and you try something on, you see if it fits, and then you modify it. And so you have to have time to do that. So there are other conditions like I just named that are, well, in some individuals, I have good success, and in other individuals, because it's a complex process with those particular conditions. So hopefully I answered your question there.
Yeah, I love that idea of, trying different things on and tailoring it. I love that you mentioned that.
Yeah, that's a great analogy. And it also brings to mind screening patients, Dan, or do you have an application process? I'm sure that there are many patients who want to meet with you and establish care with you. And some practices, they will screen patients before saying, I think we're a good fit. Look at those goals. Are they really only looking for symptom support? Or are they willing to put in the work and to work on those foundations? Are you doing any kind of screening like that for your practice?
I do some screening.
Yeah.
I think so. And right now I am just virtual. So whereas before I was seeing small children, I don't see small children anymore. And nor do I really, while I do see older adults that have significant cognitive impairment, that
Mhm.
is really, really difficult to do for anybody. But I find it just in the practice that I have, I screen those two groups out. And I think there are certain, there's some conditions that I may just not feel that I have enough expertise. So I do some screening that way. But those I would say are kind of the main screenings that I do with individuals. And and I do appreciate the idea that, well, you want to try to maximize your success. So screening people that way, and I appreciate that. But I take many different types of people, and I don't screen for their motivation.
Mhm.
I think they kind of screen out eventually if they're not motivated, because I
Well
think, as you
said.
know, Emmy, and as we all know, it's we all want a pill for an ill, and functional medicine, naturopathic medicine is a collaborative process, and
Mhm.
and somebody should be interested in knowing that we're going to be asking them to do things to help themselves.
Mhm. Right. And your website, I will say, is very thoughtful in how you explain what functional medicine is. So I think patients will know what to expect taking a look at that. But it's a great point that it's a little bit of a self-selection, and that it's important to realize that it does take some legwork, but it's sustainable. It's more sustainable than kind of the traditional model, depending on the condition we're looking at. So which brings me to the specifics. If we can talk about our tools of the trade, if you will, after years in the field, you're obviously privy to the evolution of functional medicine and now enormously wide spanning products that functional medicine has attracted to the space. So everything from wearables. So, we can think about CGMs, we're thinking about grounding mats, vagus nerve stimulators, all of these products. I'm curious, what do you think about those products in addition to supplements and labs? How do you screen for the best? I suspect you'll mention research. Is there research on these things, on these modalities, on these specific products? And what should practitioners look for in that research, or kind of how should they judge what is a good product?
That's a great point, and a great question, I should say, and a difficult question, I think, to answer, because I think we should all be really looking at the clinical evidence, not only around some of these apps, but certainly around pharmaceuticals and laboratory testing. And I think that one, and what I tell patients and when I'm talking to colleagues, I think from a supplement standpoint, I think that it's very important to go with trusted sources, and to go with companies that have a reputation to protect, and to go with companies that will on request give you some of their QA/QC data. And there are many companies in the field now, and that are very well respected and have done a wonderful job of elevating the field. And at the same time, it's the Wild West out there, and there are
Hmm.
many I'll say it, I think, unscrupulous companies that are, just part of the ecosystem, that it's very easy for a patient, and also for a clinician to just accept a lab or a supplement company's word for it. And so I think we have to be very careful of making those choices. And as I tell patients, is I don't really, if I tell them specific brands, and I don't really care where they get that brand. They can get it from me. I have an online pharmacy, but if they get it somewhere else, that's fine. But they should get that brand, because there's just, as we all know, there's all sorts of data out there many of these supplement companies, these unscrupulous supplement companies, they just don't have very good products. And therefore you have somebody coming into you and they say, well, I've tried that. I've tried ashwagandha. I've tried echinacea. I've tried berberine, and it didn't, quote unquote, it didn't work for me. Well, number one, how much were you taking? Because there are many supplements that the amounts of those things are just window dressing. They're not based on the evidence. And number two, is there really that particular ingredient in the supplement? So that's why I think in order for us all to bring the field forward, we really need to enlist those commercial companies in elevating the field. And that goes for, I was talking about supplements, but it goes for laboratories too. That and the labs and supplement companies that are part of our exhibitors, we do a vetting process on them so that we can make sure that they are living up to the standards that we think those commercial interests should be living up to. So I guess that's, again, as you can see, I'm a bit long-winded, but that's the way that I look at these supplements and these laboratory evaluations. You have to make sure that they are passing that bar.
I think that's helpful, and just making listeners aware that you can ask for these things. You can call up a supplement company, you can call up a lab and ask for validation reports. You can ask for control reports, and that's important. And of course, we think about going to the drugstore. They're just not all created equal. So it's something we think about professional grade, but what does that mean? So just having that awareness, as you said, or a vetting process is very important. So I think you got that.
That's exactly right. And I think while there are a number of Achilles heels in this thing that we call integrative medicine or functional medicine or naturopathic medicine, I think that one of the most obvious Achilles heels is not having accurate supplements and accurate laboratory evaluations. And that really puts us, number one, behind the eight ball, puts all of us behind the eight ball, because it's then very easy for a consumer to read that headline that this product was, contaminated, or this product didn't have what it said it had in it. And then the whole field doesn't go forward, doesn't rise, because I think that what I'd like to think is that functional medicine is an evidence-based process, that you're not just making this stuff up. You're looking at the clinical evidence, you're looking at the research evidence, and there's a lot of research evidence for a lot of this laboratory evaluation and a lot of this nutraceutical or botanicals. And it can get muddied if you have commercial interests who are not doing a good job of keeping those kinds of things at top of mind.
That's such a great point too. It's a call to action, really, to ask those questions and vote with your dollar as a practitioner in terms of what we're recommending to our patients. So
Right.
we can really weed out the lower quality ones and protect our reputation. And so we can keep getting those good patient outcomes. That's a really nice angle at which you came at that. So thank you for that.
And then I have to ask you now, as kind of staying on the topic of treatment tools and protocols, I have to ask you about fasting, because I saw a course on your website. I think it was called like Fasting for Health. And, I was like, I can't wait to ask you about this. I love the concept of fasting because it's free. It doesn't, we just talked about, the cost of supplements can be really high, but it's like fasting is so accessible because it doesn't cost anything for people. So where do you use this in protocols, and, what conditions really benefit from this the most?
Fasting, I think, is just for the reason that you said, it's simple and it's free, and at some level it's very easy. So I'll answer your question in your specific question, but I differentiate in terms of what I call time restricted eating and then what I call fasting. So anything that is cyclical below 24 hours is time restricted eating. Yeah, we all do time restricted eating. We all go to sleep sometime and then wake up sometime, and we're not eating during that time. Maybe some of us are eating in the middle of the night, but we're still fasting for those 3 or 4 hours. So that's time restricted eating. And I think that, so you can do where I think the research suggests some benefits for time restricted eating. Start at 12 hours. So an overnight fast. So you stop eating at 8 p.m. You start eating at 8 a.m. That's a 12-hour time restricted eating. And so 12 to 14 to 16, there is a lot of research that suggests that can be helpful for things like metabolic syndrome or insulin insensitivity and diabetes and some cognition issues, weight loss over time. This whole process of autophagy or mitophagy seems to start somewhere in that time frame. So this cellular cleanup or organelle cleanup, if we're talking about mitophagy, that's a very important process that I think everybody, with some exceptions, I don't use time restricted eating, or I don't suggest it for children or pregnant women or individuals that may have some eating issues, eating disorders. But I think that many people can benefit over the long term with having some sort of time restricted eating protocol or process in place for many days out of the week. So that's the kind of the first answer. For many people can benefit from that. And then if we're looking at anything over 24 hours, which I would then call quote unquote fasting, so 24 to 36 to 48 to 72, I think that those done on a cyclical basis. So sometimes once a quarter, some of those can be once a week or once a month, etc. Those can help in a number of other conditions, and I don't suggest those for everyone, but I think those can be very useful in diabetes and cognitive issues, certainly in weight loss. And so a lot of people can benefit from that. There are certain things that you want to be conscious and cognizant of in terms of weight loss. What kind of weight loss are you getting? You obviously want to lose fat. You don't want to lose muscle. There's ways that you can highlight the kind of weight loss that you're looking for. So time restricted eating and fasting, I incorporate in many of the patients that I see.
Do you use it ever for just like as a preventative measure or more so just in treatment?
I definitely, I mean, most, if not all people that are coming to me are coming to me with, they have some problem that some health issue. So I guess you could say that I use it, proactively as part of that. But I think that using it preventatively, and there's again, a lot of research that how it can maintain insulin sensitivity, maintain weight, how it seems to have some preventative effects, both because of both of those things, likely some preventative effects in terms of certain kinds of cancers and cardiovascular disease and cognitive decline. That is, there've been no long-term studies on that, but there's a lot of studies that suggest that there is likely to be benefit in all of those things long term. So that's the preventative aspect of that. And so I think because particularly with time restricted eating, there are, I think, very few long-term downsides to it. So if you're doing it correctly and you're maintaining your muscle mass and maintaining protein intake, et cetera, I think there's not a downside to doing that kind of short-term time restricted eating over time. And so I think it's a very good preventative strategy. And I teach some classes on just doing that for patients who really are looking for certain health benefits, but they're also looking to maintain or enhance their long-term health. So again, that's a long-winded way of saying, yep, I think there's a lot to be said for using that in a preventative manner.
Well, I know we're coming up on the hours, so I don't want to take up too much of your time today, Deanna. We probably could have gone on all afternoon with so many different questions. You have such a wide bank of knowledge and so much experience in functional medicine, and I'm really glad we got to have you on the podcast today and pick your brain a little bit. But before we close, I always like to end the episode on a really positive note and ask all of our guests the same question: what does it mean to you to live a vibrant life?
What does it mean to me to live a vibrant life? I would say it means understanding first and perhaps foremost, understanding what my why is. Why do I want to get up in the morning? Why do I want to see patients? What is it? Why is that important? And that's if I can maintain that, which I don't always, which sometimes we all have ups and downs and we wonder about why we're doing certain things that we're doing. But if we keep that front and center as much as we can, that leads to all of these different things that we do or that I try to do that lead to a vibrant.
We all have those days, where it's a little bit more challenging and we have to remind ourselves, what our why is sometimes. But I love
Yep,
that.
yep, yep,
And
absolutely.
where
What
can
do you
our
do? What do you do, Melissa? What do you do to lead a vibrant life?
Oh, what do I do to live a vibrant life? Oh, I don't know. No one's
Or
ever asked me.
I'll change that. What you asked the question of what does it mean to lead a vibrant life, right?
Yeah, I think just kind of fulfilling what I believe to be my purpose. As long as I, can show up every day and, serve other people, I think that's fulfilling enough for me.
I think we're on the same page. I think you said it in a shorter way. I said it in a longer way.
I mean, now we have to go full circle here.
Oh gosh, I'm going to go back to naturopathic medicine. It's that vitality. And I feel vital when I am serving others in some way, but it could be music, it could be dance. I mean, I have a lot of things that make me feel vital. Laughing is very good medicine for me, and I think for most people. So if I feel vital, I equate that to vibrancy.
Good.
And Dan, where can our listeners find you?
I would refer everyone to ifm.org, and you can find me on that website. You can get in touch with me there. But I think hopefully if you go to the Institute for Functional Medicine, and you'll find a lot of resources, both for if you're a patient, a quote unquote consumer, an activated consumer, or if you're a clinician. We have a lot of what I'd like to think are very useful educational resources for the clinician and the consumer.
We'll be sure to link this down below in the show notes for everyone listening so you can easily find it. And thank you again, Dr. Lukaczer, for sitting down today and just adding so much value to this podcast. I know our listeners, whether they're practitioners or clinicians or even patients, I know they're going to get a lot out of this episode. And thank you to our listeners for tuning in today. And until next week, stay vibrant, everyone.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.